wherein we had said that the present complaints should be in the patient's own words, because you do not want to misinterpret information that the patient might be providing to you. So I had explained this slide, maybe just a quick recap of this, because many a times it so happens that if the patient is saying that I have got pain around the hip joint, and you write down I have got pain in the hip joint, both these can lead to a misinterpretation of the information, because around the hip joint may not necessarily be coming from the hip joint. Okay, but if you write down in the hip joint instead, you are making a person believe that the pain is coming from the hip joint. Okay, and then one tends to overlook the other reasons that may be presenting with pain at the hip. All right, so essentially you should exercise caution in the way you are interpreting the patient's narration, and that is why it has been mentioned that you should preferably have it written in their own words. Okay, and like I said, many a times it has been our observation that they will tell you that they have got a specific function that they are unable to perform or have difficulty performing, in which case you should explore as to what is causing that difficulty. So you then specify the complaint, the location, as well as the duration of that particular complaint. Okay, fine. So coming on to the actual history. So there are three domains under which we do this: O, D, and P. That is the onset, duration, and the progression. So essentially that is what you are going to be finding out, and more and more information as you collect, you will be able to arrive at some diagnosis at the end of the history, which will essentially give you a direction towards the further examination as we go about it. Okay, so you can see on the slide you are finding out two things. One is, how is it that whatever complaint they had began? Okay, so was it of a sudden onset? Sudden onset means it was not there yesterday and it is there today. Okay, or it was not there 2 hours before and it is there now. So there would usually, in a case like that, be some episode which the patient will be able to recollect. Okay, they will be able to tell you that, okay, I was absolutely all right, and suddenly it was a movement where I bent down to pick up something, and I had this catch in the back. Okay, or I was playing maybe badminton for some time, but it was this particular stroke that hit me hard, and that is since when I have started having this pain in the shoulder. Okay, so these are situations where it is a sudden onset of the complaint. Okay, the examples that I gave you were of pain, but it could very well be a fracture, wherein they will state that, okay, this was a road traffic accident that I met with, and this is what I have landed up with. Okay, so there are certain situations and certain conditions that we present with a sudden onset pain, and these are mostly those which are going to land up having a trauma which is of a nature like a strain or sprain, like an ankle sprain, ligament injuries, bony traumas, and so on. Okay, most of the other conditions which we commonly see in the OPD, okay, we call them cold orthogenesis, which are really not of the traumatic in nature. So the sudden onset are most of the times traumatic in nature, but the second and the third, that is the gradual and the insidious onset, are the ones that form the majority of the population that visits our OPD for